Je suis avec Manjot Gill du Northwestern University of Chicago. Manjot, you just did a marvelous talk on Photon, and I would like you to explain to us how, first of all, how was the bullet point of your talk, and then how could we discriminate between good and bad patients in DME?
Well, thank you, Isabel. So the Photon study, as we know, was a randomized, double-blinded controlled trial that investigated 8 milligram Aflibercept administered Q12 and Q16 and compared it to 2 milligrams of Aflibercept administered on-label Q8. And in essence, we were able to find that we had non-inferior best-corrected visual acuity outcomes through weeks 48 of the study in patients who were treated with the 8 milligrams, both Q12 and Q16, with a significant percentage of patients, almost 80% of patients, being able to be extended to greater than 12-week interval by the end of the 48 weeks. So what we looked at was a subgroup analysis to investigate patients who had had prior DME treatment, of which almost 44% had had previous treatment for DME who were enrolled in that study. And that previous treatment could have been prior anti-VEGF, prior laser, or even corticosteroids. So our subgroup analysis did reveal that eyes that were in the 8 milligram Q16 arm who had had prior DME treatment had the lowest best-corrected visual acuity gains compared to those in the 2 milligram Q8 and 8 milligram Q12. So what that suggests is that eyes that have a longer treatment interval probably do need to be treated more frequently if they have had prior DME treatment. So to put it in another way, so if you have a patient who comes to you and has had prior treatment for DME, they will likely benefit from more frequent injections and probably cannot go to the 8 milligram Q16, at least initially for the first 2 years, as our study had indicated. We did find, however, that central retinal thickness improvements were similar across all treatment arms, whether they had previous DME treatment or not. We also found a similar percentage of patients were able to be extended to a greater than 20-week interval by the end of the 2 years of the study, regardless of their prior DME treatment status. So it really was, I think, most indicative that patients who were in the 8 milligram Q16 that could likely benefit from more frequent injections, at least throughout our study period.